It is the voice of Indiana County, WCCS AM 1160, 101.1 FM. And you can check us out on video a little bit later as we talk with Dr. Ronald Cramer this morning, the IRMC Physician Group. New to IRMC, not exactly new to Indiana. Good morning.
Good morning.
It's good to have you back with us here this morning, or with us for the very first time. Yeah.
First time.
First time. Let's move the microphone a little closer to you. Just a little poosh like that. And that'll help us get a better audio product out here. Gastroenterology. You know, when we did the commercial, we looked at everything that gastroenterology is, and it's kind of hard to list it. Gastroenterology basically is whatever's in your body from top to bottom, isn't it?
Can be. In general, thought of as below the diaphragm and all your guts.
Oh, your guts. Well, let's talk about some of the issues people have with their guts. When people are feeling generally bad, and is there a pretty good chance that it has something to do with the gastro system? Just generally not feeling well.
It would. It could.
Yeah. Okay. So people come to see you for all types of different illnesses and ailments. Let's sort of track. There's no such thing as a typical patient, I know, but some
there are.
There are, really?
Heartburn's pretty typical.
Is it?
Problems with bowel movements are pretty typical. Bleeding's pretty typical. Pain's pretty typical. Sometimes you can branch out from common complaints to things that aren't quite so common, but we see a lot of relatively common complaints.
Do they have a relatively similar basis? I mean, can you trace them to?
Yeah, usually.
Really?
Common things. Try and be uncommonly good at dealing with common things, and part of that is when they branch out into things that aren't quite so common, being able to pick up on that.
Okay. Some of the things that people need to do in order to protect their gastrointestinal system, because, we live our lives and generally we don't go to see a guy like you unless we have something going on. And I don't want to cost you business here, but what can we do to avoid coming to see you?
Don't eat fair food.
Here now.
Probably shouldn't have said that right now. No, you should at times for preventative measures. I mean, everybody over the age of 50 is supposed to have a colonoscopy done. Age varies a little bit depending on circumstances. If you've had heartburn for a long time, you should come and see us. You can have terrible heartburn and not have any damage to your esophagus, vice versa. It can be somewhat of a bother and very significant changes to your esophagus. So there are certain complaints that if you come, that you can obtain a preventative type service that can save you lots of problems down the road.
Is heartburn especially difficult for people to put a finger on? They feel it, but they're not quite sure what it is.
Well, there are typical heartburn symptoms, and then there's atypical heartburn symptoms. The atypical symptoms can be as far out as asthma and only asthma. But typical heartburn's pretty clear, and it can be pretty miserable.
Yeah.
Sometimes chest pain's difficult because it feels like you're having a heart attack. You go to the emergency room and there's no heart problems. We're usually the next people in line that people come to.
Yeah. Generally, when you hear that, and it's in your basic television scenario, it's just heartburn, take a Tums.
No,
it's a little bit more complicated than that,
Go
isn't
get
it?
your heart checked out. If your heart stops, we lose you as a patient. If you have heartburn, you just don't feel like living sometimes.
Okay.
So.
You mentioned colonoscopies, and they are really a big deal in people's lives, particularly the older they get. What are the things we're looking for in a typical colonoscopy? I've got no symptoms of anything, but I hear I should be having a colonoscopy from time to time. What are you looking for?
Like we said, it's a preventative thing because, in general, from onset of the polyp process, it takes about 10 years for that polyp to transform into a cancer. So that's a nice big window. And oftentimes, polyps are asymptomatic. particularly when they're small and easy to remove. So age, we look for age. Anybody over the age of 50, sometimes 45, sometimes different because of a family history, but we look for age. And if you're of a certain age and it's been a period of time since you've had a colonoscopy, or you've never had a colonoscopy, you should. Because we can find things, take them out, and it saves you a lot of headaches down the road. It's much easier to deal with a small polyp than it is with a colon cancer.
Yeah. Well, colonoscopies certainly will help you to figure that out. And colon cancer, if caught in that early process, it's completely curable, isn't it, Doc?
Preventable, curable?
Yeah.
Preventable.
Yeah, preventable. Okay. Very good. Some of the other things that we talk about with gastrointestinal issues within the body, hepatitis. Let's spend some time talking about that. There are various forms of that too, aren't there?
Yeah. The World Health Organization has mandated that hepatitis C be cured in about 10 years. So that's a viral form of hepatitis. People of certain ages should be screened for that also.
Okay.
Easy treatments relative to the way it used to be treated a long time ago. It used to be shots, and it was a year long, and terrible side effects. Now, if you happen to have hepatitis C for whatever reason, it's a relatively short course of pills, which are 95% effective. So if you're somebody infected with hepatitis C, you run the risk of bad liver problems, other types of problems that hepatitis C can cause, and it's really a relatively easy thing to treat. It's been cool to be able to see it from the time it was just a pain to treat until now, when it's you see the progression of things, and so that's a good thing. But there's viral types of hepatitis, there's autoimmune types of hepatitis, there's inherited types of hepatitis, all sorts of different stuff.
We should like our livers, shouldn't we not?
Problem with liver problems are that oftentimes, if you do have a liver problem, it's not until there's been an extensive amount of damage done that you begin to have symptoms from it. And when you begin to have symptoms, you're really, really sick.
Okay. So those are things to watch out for as well. Is there a way to screen for those sorts of ailments for liver?
Sometimes people just get routine blood work and they notice that their liver tests are up a little bit, and their docs will send them over to kind of get that checked out. And subsequently you find something they didn't know they had.
We're talking with Dr. Ronald Cramer this morning. It's our Meet the Physicians segment here we do with the IRMC Physician Group. So let's meet you a little bit. Born in Indiana, huh?
Yeah.
But not raised in Indiana?
No, not raised here, but grandparents lived just down the street on East Pike.
Oh, yeah.
A lot of other family members were here. So I'd be back 1 or 2 times a year. Pretty familiar with the area.
Take us on the career journey here for us. Where did you go to med school, and where have you been?
Well, I went to medical school in North Miami Beach. And from there came back to PA. I grew up in Michigan in East Lansing. So when it came time to leave medical school and do a rotating internship, you kind of take a map of the 2 states and start throwing dots or darts to see which one you want to come back to, because I wasn't real fond of Florida.
Oh, really?
No, particularly Miami. And one hit in Clarion up the road. So I did that there, did the year there, and then trained at West Penn for both medicine and my GI fellowship, and then went back to Clarion, and we were in private practice there for about 20 years.
And now you come to Indiana?
Indiana, which is a really nice town and very comfortable place to be.
What brought you here? What was
my car?
The decision maker? That I'm pumped. Okay. We didn't have the drummer come in this morning. I could have had the rim shot there for you.
Just very familiar with the area, and there was a need.
Yeah.
So it seemed like a easy fit transitioning.
And at IRMC, of course, I don't know how much experience you had with the hospital before, but the upgrades over the last 5 or 10 years have just been tremendous, and you probably noticed that in the OR.
Yeah, I was born here in that hospital, and it was just a small fraction of what it is right now. It's a pretty impressive place for a Western Pennsylvania rural hospital. They've they've done a nice job of adding on. Even the way they've added on has been very strategic, and so it's a very nice place.
Yeah. So working there, you get a chance to maybe renew some old acquaintances, if not all of them, because you're meeting new folks all the time. How do folks hook up with you and become one of your patients?
Typically, they are referred from their PCP or their family doc. I guess they can call a number that I was just handed. 888-452-IRMC. And there's a website too, the IRMCdocs.org website.
There you go.
They can go to and
Hook it up with Dr. Ronald Cramer in the IRMC Physician Group. It's been good to meet you here today.
Nice to meet you.
I'm glad that you were able to come in and spend some time with us.
Thanks for having me.
People got the belly aching. He's the guy to go see. Appreciate it.
Thank you.
It is the voice of Indiana County, WCCS AM 1160 and 101.1 FM.